It's good to see such a good crowd this morning. And I think that you have come from afar and you've come from near. And it's good that you could make yourself available for this important event. And on behalf of the City of Hazard, I'd like to thank you for coming this morning as we celebrate another milestone for ARH, for Hazard, and for Perry County. We are fortunate to have a health care provider such as ARH, and we are excited about the new cardiac care partnership that ARH has formed with the renowned UK Healthcare.
You know, I think that, and I'm Mike Carth, I'm the Executive Vice President for Health Affairs at UK. And although we're celebrating this partnership and collaboration among UK healthcare professionals, is really the people of Hazard that will be gaining today. I think all of you know that heart disease is a very significant problem in Perry County. Perry County has the highest incidence of heart disease in the state of Kentucky, and Kentucky has one of the highest incidence of heart disease in the United States. And it's time to do something about that, and we hope that this agreement between ARH and UK Healthcare will be a major step in that direction. Working together, I think we'll be able to effectively approach cardiac care in a much more systematic fashion, in a much more aggressive fashion. Now, it's not only ARH and UK Healthcare that are working together. More importantly, it's a number of physicians in Hazard that will be working with us and being a part of UK Healthcare's Gill Heart Institute. And I think that I'd particularly like to acknowledge the physicians from Hazard cardiologist, Dr. Yalamachi, would you please stand up? Dr. Rao and Dr. Srini. We also have Dr. Kenneth, I'm not going to try your first name, okay, from Williamstown. And we have Dr. Bakari, who's been working with Gill Heart Institute. These are the folks that are working with our physicians that will ultimately make the difference. These highly qualified cardiologists are well known for their excellent care in this region, and it will be an integral part of our program and its success in offering a new level of services and care to heart patients in this region. Now, along with them, we'll be working Dr. Ed Setzer. Would you stand up, Ed? And he'll be addressing you in a couple of minutes. We were very proud to recruit Ed to Hazard, and I can give him the highest commendation. That is, his skills are so good that if I needed heart surgery, I wouldn't hesitate for a second for Ed to do my heart surgery. And I'm very particular on who I'd have do my heart surgery. It's just an outstanding addition to this community, not only as a surgeon, but as an individual. So our goal is for us to expand cardiac services, not only in Hazard, but all of southeastern Kentucky, and work with all of the ARH hospitals, and keep as many people in southeastern Kentucky getting the very best cardiac care as possible. And if they need to go to a higher level of care, if they need a very specialized procedure that isn't available in this community, we'll make sure that their referrals to UK Healthcare and the Gill Heart Institute, which now is a national leader in cardiac care, is as expeditious as possible. So I think this will bring great value to the community.
And I want to especially thank Mike Carth. I have studied academic health centers for the last 3 decades. I've only been in Kentucky for 2 years. I can say this, when you're going to look back over the last decade and see the greatest successes amongst academic health centers, you're going to find it right here in the state of Kentucky at the University of Kentucky. It's under Dr. Carth's leadership that we have made a commitment to high-tech, high-touch, and compassionate care. And the way we have been successful is through our partnerships with communities that we celebrate today. So our commitment under Dr. Carth's leadership has been, let people get the care they need closest to home when they can. If they need to be referred to a place that does more of a more sophisticated type of care, let's be part of that network, and that's what we're trying to do with this relationship. We're extending this partnership. I say often now at the University of Kentucky that success has lots of mothers and fathers. So I want to recognize some of those people today. First of all, Joe Grossman and our partners at Appalachian Regional Healthcare and the Appalachian Heart Center. Our success in providing this quality care wouldn't be possible without these best local resources. Dr. Karff, Dr. Susan Smythe. Thank you, Susan. She is leading an incredible research endeavor at the University of Kentucky. And then you've heard about Dr. Ed Setzer. Our community partners, Mayor Nan Gorman, who made me a Duke of Hazzard my first visit here. Thank you. Donna McClure from Senator McConnell's office, who's been a friend since I've arrived here as well. And then we all acknowledge Tim Couch and his tireless advocacy on behalf of this project.
You know, the day started with Mayor Gorman saying that Hazzard ARH is Hazzard's hospital, and that's how we see it. You know, we're nothing without the people of Hazzard, without them putting their faith and their trust and their care in us. And then Dr. Karp talked about a partnership, and I just used the word trust. And a partnership is based on trust. In working with Dr. Karp and his team, I will tell you I have the utmost trust in them and the model that they have in their vision and that we share. And that is, let's make sure that we provide the appropriate level of care as close to home as possible. But first and foremost, it's a great day for the citizens of the people of Perry County and the surrounding communities to be able to enhance the services that they receive closer to home. And when they do need that higher level of service, a smooth transition from their setting here to the Gill Heart Institute in Lexington. And this goes beyond these regions. This will include most of our southeastern Kentucky hospitals. It affects every one of the communities that we serve, and that's so important.
For the last several years, the Gill Heart Institute has positioned itself to be a destination-level center for advanced cardiovascular care. We now have a team of superb cardiologists, surgeons, scientists who work together to provide the most advanced state-of-the-art technologies, procedures, and medications for our patients here in Kentucky and this region of the United States. Our team has now available procedures such as minimally invasive valve procedures that are performed in our state-of-the-art hybrid OR, ventricular assist devices, total artificial hearts, cardiac transplantation, cardiovascular imaging that allows us to visualize the heart and the blood vessels in ways that we've never been able to do before, approaches to atrial fibrillation that are really mind-astounding. What this means for patients in Hazzard and for the rest of the state is that there is no reason any longer for anyone in our state to have to go beyond the state's borders to get the most advanced cardiovascular care. I can say that today with confidence, that our patients should no longer have to leave the state because of the types of care that we can provide in Lexington.
This is indeed an exciting time. A partnership between a nationally recognized tertiary healthcare center and a strong established regional healthcare system, with the ultimate goal of delivering excellent, cost-efficient healthcare to all, maximizing utilization of healthcare resources without competition. Monica and I were privileged to join the University of Kentucky 2.5 years ago, and we were further privileged to join the Hazzard community to establish a cardiovascular and thoracic surgical program in conjunction with the university and ARH. Today is the next step in furthering that relationship. I have had the privilege to work with Dr. Yalamanchi, Dr. Rao, Dr. Serini, and more recently Dr. Bakari. I dare say I think our results have been excellent, offering care locally when appropriate and referral to UK when additional sources available at a tertiary center were deemed necessary.
2 years ago, I went to my family physician just for a regular check. And I seemed to check out all right, and as I was leaving the office, I was reminded about the fact that there was something I didn't tell him. And I had to go back, and I actually went back and got his attention, and I said, you know, every now and then I'll have a little pain right here. And he said, well, let's do an electrocardiogram. And it came out bad. And he immediately made a referral to Dr. Yalamachi. And Dr. Yalamachi took electrocardiogram also, and I can still remember his words. He looked at it and he said, well, it isn't that bad. But he says, you know, there are a lot of silent things. And so I did the catheterization. And that really showed what was going on. And immediately following the catheterization, I don't know if I was drugged or what was the case, but I woke up and there was Dr. Setzer and his wife, Monica. And Dr. Setzer drew exactly what was going on and pointed out that my main artery was 80% blocked. Who would have known? And he gave me the options of what I would do. Now, it's really hard to change a pastor's mind. And over the years, I was kind of the mind of many people is that when you have something major like this, you shuttle off to Lexington. And here I was, and my wife was there also, and we thought about what we needed to do. And we really made it almost an immediate decision. And I made it with real confidence and peace about it, that, hey, it needed to happen right here. It was the first time I ever met Dr. Setzer. He'd only been here a short time. And, of course, being in and out of the hospital as a pastor over the years, I always looked and observed and did a lot of things like that, listened to people. And so I said, I am going to observe and see how I am treated. And I was amazed. I was amazed at how everything proceeded. And I continued on after the surgery with the ARH rehabilitation program, which I go there every week, and have found everything up to the T.
Thank you so much, Reverend Stiles. He encapsulated everything. That's the story. It's about teamwork. It's about making sure you can get things done in Hazard and not have to go to Lexington. The more we can do in Hazard, the better off the folks in Hazard are. But if you need something you can't do in Hazard, you need the backup of a place like UK Healthcare.